In a cold and blowy London, I'm joined today by Dr Aisha Alayafi. And Dr Aisha is the Resource Mobilisation Specialist at the Islamic Solidarity Fund for Development, which is part of the Islamic Development Bank. Welcome, Dr Aisha.
Thank you so much.
I wonder whether you could just tell us a little bit about the bank and the ISFD and what it does.
بسم الله الرحمن الرحيم والصلاة والسلام على أشرف الأنبياء والمرسلين. Actually, ISFD is the poverty arm of the IDB, and let me tell you a little bit about the history of IDB. Yeah. IDB has been established more than 46 years ago, and King Faisal, when there is a meeting in the Islamic conference, and he found out, he asked, there is a World Bank at Washington DC, there is an African bank, there is an Asian bank in Philippines, and he said, what about Muslim? Who's helping those poor Muslim? And they told him nothing. Nobody is helping them. And he said, okay, let's establish the IDB. So he established IDB to help the poor around the world, the Muslim community around the world. And so a lot of member countries, they joined the bank, which is the OIC member country, they joined the IDB, and they become part of the stakeholder to help fighting poverty. Then after a couple of years, they found out there is a Muslim community in a member country who needs the help to support them. So they start to open a department called Special Assistant that can help the Muslim community in a member country, such as people living in the UK or people living in America or in Australia, a Muslim community that they need, they are minority and they need help and support. So therefore, he opened that department to, the IDB opened that department. Yeah. Then in 2008, they found out that we need to concentrate, really, a department really concentrate on the poverty itself. So they opened the Islamic Solidarity Fund, there where I'm working right now, to help in fighting poverty and taking care of the vulnerable group. And in ISFD, not only fighting poverty, actually we give economic empowerment to the youth. So we do have microfinance, to Islamic microfinance, which is no interest, to help fighting poverty. We empower women. We have a fistula repair program. We have a blindness campaign that we can do operation, a cataract operation in different country to help people to reside to gain their reside.
That's a huge remit. That's a huge remit for the ISFD, and I know that there are, huge amount of different stakeholders that you go to raise funding and raise visibility for the cause, everything from government to philanthropists, etc. So I'm interested, at the moment you are focused on resource mobilisation, so fundraising and communications. Just could you tell us, just give us a flavour of the journey of how you got here, where you started and how you got to your position now?
Okay. In the beginning, my background is health. So I've been sent from the military hospital to study health in America, and it was a PhD program. Then I found myself I have to travel to visit my dad, who was in Rome, and the flight was late in New York airport. Then I found myself that, okay, let me do something, 4 hours, what can I do? So I went to they call interfaith rooms, like meditation room. I prayed there, which was beautiful. It's showing Christian, Jewish, and Muslim in that room, everybody doing the meditation. Yeah. I felt so comfortable. I said, oh my God, so we don't have a conflict of religion, we have conflict of culture. So because the three religions in one room. So I prayed, and after that, I thought, okay, let me buy a book to read. So I went to the bookstore in the airport, and I found out a book called The Bank of the Poor. And I said, oh my God, I know the rich people, they have the bank, but the poor people, how come they have the bank? They don't have even the money. That book was talking about the poverty. talking about the Professor Yunus, who's the author of the book. They're talking about Islamic microfinance that he done in Bangladesh, and how the life of people has been changed. So how has been moved from the line of poverty to better life. So for me, like, and they're talking about 60% of Muslim community, they are the poor, and they're talking about the different type of poverty. I never thought about it. I thought it's only poverty is food. People, they don't have the nice house to live in. I don't know, there is a poverty in health, poverty in education. People, they cannot get the vaccine because in Saudi Arabia, vaccine is free. So for me, it was like, how people, they can have a vaccine. So education in Saudi Arabia is free too. So I thought, how people, they cannot have education. So for me, it was like going from the context of my country, which is everything's free, to a context of people they don't have. They cannot afford to pay for education. They cannot afford to pay for health. They cannot afford to live in a good house, and decent house actually. And it just really moved my heart. And I thought, why only I'm studying health? I'm working for, in one dimension, which is, yes, a humanitarian, which is fighting disease, but I thought, why I don't have, opportunity to serve better humanitarian approach, which is health, education, economic empowerment, empowering women, all this type of different type of humanitarian, different domain of humanity. So therefore, I decide to study something that can help me to work on this type of field. So I decided to switch from only health to study public health with concentration on global health, which can help me. So I had my PhD in global health, which is concentration on everything related health, but from global perspective. So then the first job that I get is at the World Bank at Washington, D.C. I was the first Saudi professional work in MENA region, Middle East and North Africa, and it was health, education, and social protection. Then after that, my brother died, and my mom was so depressed. Then she asked me to come to support her because she was not eating properly. She feels so depressed. So I came back. I said, I already graduated. I can stand with my 2 kids, helping my mom to get through the difficult time. So I went to Saudi Arabia and I sent my resume to IDB. I immediately, within 2 weeks, maybe because of her prayer, I joined IDB as the first health specialist in IDB 2008. Then after 2 years, I found out nothing has been done for women. And I thought, okay, I want to switch my career to a gender specialist. I get some classes from UK, at UK University about gender. And then I work as a gender specialist.
And you were the first
woman, full professional woman, full professional woman in IDB. Okay. Yes.
Yeah, I work since then, but that must have been challenging.
That's very challenging because for 35 years they don't have any woman working in that in the IDB building. I was the first among professional, full professional. They have the young professional, but I was the full professional working in IDB.
Wow.
Yeah.
Okay.
Yeah.
So
it was, and that time was dividing to Arab speaking and English and French, and then the reform start, and I was part of the reforming, and then there is a company called assessing the managerial skills of people called Mercer. And I've been gone through the assessment, and I've been as a ready manager. It's been already assessed as a ready manager in that time. Yeah. Then after that, the ISFD, they start to establish ISFD, which is the poverty arm for the bank. So I thought, I want to be part of this new initiative. So I moved from the health division to be a poverty specialist in ISFD. I work in ISFD. Then I found out there is 2 issues is missing there, which is resource mobilization, because after Arab Spring, a lot of the level of a lot of vulnerable group around us in Middle East. So we thought on a lot of countries they wouldn't be able actually to support the fund. So I thought, I want to work as a resource mobilization and fundraising specialist. I get some classes, and up to now I'm getting a lot of classes too for helping, because I believe everything needs knowledge. So I start to get some knowledge. Then finally, I found out in order to do fundraising and resource mobilization, I have to study about media and communication. And then IDB, they sent me to Columbia University in New York to study media and communication and media and international communication. Because for fundraising, people, to ask them to give money, or governors, you have to show the success, what we are doing on the ground, how we are fighting poverty, how we are helping, to decrease, the level of poverty line among the people. Therefore, I thought it's very important to study media.
I mean, so it's all about winning hearts and minds, isn't it?
Exactly,
really?
exactly.
Well, look, that's quite some journey. That's very inspirational, Dr. Aisha. We've moved into communications and marketing now, so let's just talk a little bit about that. What's your view on how marketing and people's media preferences are changing, and the challenges in getting to them, and technology and things like that? Where do you see this going?
To be honest, I thought is media and communication is very important for all the field. Either you're working in selling product, or you're working fighting poverty, or for political. I thought it's very important. Media is the key factor actually for success. So I thought I feel it's very important to people to. Right now, everybody has the cell phone in his hand. So all the media is in their hand, all the social platform is there. So I think it's really great, and people, they know how to use it, and how to really reach to the audience, the right audience, with the right message on the right time, in order to reach to your goal.
And of course, you're right, there are so many channels to get to people now, but those channels are very noisy, aren't they? There's so much going on, and people just kind of swipe and swipe and swipe. So the challenge, I guess, is to make creatively your message just stand out and stop people in their tracks, so they don't swipe and it gets through to them, isn't it?
Absolutely, I agree with you. Absolutely. And there is using not only the social platform. I have the LinkedIn. You have the websites. You have a different tools is available there.
Yeah, but I think you have particular challenges as well, because you operate in so many different countries, and some of them very sophisticated media, others not so much, are they? So you have to have different approaches for different countries.
We have 65 countries, as rightly you said. We have 65 countries in Africa, in Asia, in Middle East, like different type of audience with different language, with different approach. So it's a good challenge. I consider it as a positive good challenge actually, to have a different people, because you can send a different message with a different, like for example in COVID-19 right now, and we start to support and send a message. We help a lot of countries to go through this difficult time of the COVID. We send them, masks, we send them medicine, we send them. And not only that, we help them actually to create their own platform for awareness. So I feel like that's what's really a good success.
Yeah. Grassroots dissemination of the message.
Absolutely,
always.
absolutely.
So I mean, you've had a great career, and you've ended up, I think, from our conversations, you've ended up where you really belong. So what advice would you give anyone else starting out to wanting a career in sort of media and communications and marketing?
Let me tell you something. It's very important for me. I feel like people, they have to know, if you have, the courage, you can do whatever you want. So it doesn't mean that you study medicine, you have to be a doctor. Really, you can help the poor people. It doesn't mean that you study, teacher, you have to be a teacher all over your life, So you can, I think you can change, a career could be changed. This is number one message. Number two message, I think if the media and communication is an awesome field. And I feel it's really, really a tool to help people and to disseminate the knowledge in a very good manner, because there is a lot of noisy. So if you are full professional, you understand what you are talking about, you understand what message you want to send, you understand your audience, I think you will have great impact on the people.
Yeah. And I know that you're a great advocate for learn, and learn
exactly.
more as well. So
Exactly.
you could
Learn and go.
always be learning, I think
Yes.
is another one, isn't it?
Yeah, this is the advice of my dad. And my
Yeah.
dad always tell us, just learn and keep learning and learning, because when you get learn and get knowledgeable, you can help yourself, you can help your family, you can help your community, you can help your country, you can help the nation.
Yeah.
So for me, education is the key for everything.
Yeah, and also it's about learning what works and doing more of that, and what doesn't work.
To avoid it.
Avoid
To avoid it.
Yeah.
Yes, that's a great, that's a good.
Okay, so to end, Dr. Aisha, thank you so much for giving us some insight into your world. If you were to meet your younger self today, what advice would you give yourself?
Studying media.
What, to start with? Cut out all the other long journey.
Exactly, yes. And I think inspiring people is very important, especially our youth right now. So I want really to learn and to be part of the initiative that can help the youngest people, because I feel they're lost somewhere right now, and they need guidance, and they need to help them where is the right path for their life. Supporting and coaching, I think this is one of the field, and supporting coaching could become with the media and communication. You can reach to those young professionals, young people, to help them how to be professional in their life, how to work, how to find the right path in their life. This confusion that they have, because I feel they are restless. So with this all media, they become very restless. So they don't know where to go. They don't know. They lost the direction. So for me, it's very important actually that I can help. If I'm really young and go back to my youngest life, actually to study something that can I help the young professional, the youth, how to go and how to, because there is a lot of dream that they are the one they're gonna lead the world. So in order to lead, they have to be really occupied with a good education, with good thought, to learn from the past experience, so they don't start from scratch. Actually, it's my dream to see all the youth in all over the countries, Muslim and non-Muslim, to go on the right path in their life, because I can see some of them, they get lost, some of them they become superficial a little bit. I want them truly to be deep and to see the responsibility that they have in their hand to move the whole nation on the right direction.
Very inspiring. Thank you so much for giving us your time, Dr. Aisha.
Thank you so much for you. Have a great day.
Yeah, you too.
And thank you. Bye.
Bye-bye.